The Salvation Army Ingle Farm network of services spends much of its time and its expertise in the area of older children, youth. And we have services in youth homelessness, youth guardianship, alternative care, youth substance abuse support services, and an adolescent mums program. And as I look at our kids that we serve day in and day out, I want to tell you, and I probably don't need to, that we haven't got it all right for children and their families. So it is our hope that this will be a special event where more pieces of the puzzle come together and you'll be better equipped to do what is needed in our national community.
I recently looked at a new report that's come out from the US called Investing in Young Children, New Directions in Federal Preschool and Early Childhood Policy. Came out from the Brookings Institute about a month or two ago. And the conclusion is, the United States has a complex array of early childhood education and care systems. It would be nice to believe that these programs are woven into a cohesive fabric where the strengths of one system are combined with the strength of another, and where resources can be combined to meet the individual needs of families being served. Unfortunately, we are far from this level of coordination of effort and resources, with the result being a confusing array of services and programs for families to navigate and the constant potential for unnecessary duplication of effort and gaps in availability. I think you could say the same thing for Australia, and certainly you can say that for South Australia. They've been at it in the US for about 40 years when they started with Head Start. We started probably a lot further down the track than that. But it is a difficult, challenging problem to actually negotiate this and actually work out how we can work together better.
The theme of your conference is developing effective and integrated support for children and their families. I know this goal is something that's important to all of you, and I want to thank you all for your great contribution to the safety and well-being of children and their families. This safety and well-being of children is also at the heart of the Australian Government's social policy agenda. It did drive the establishment of the first national framework to protect Australia's children, which is all about tackling shocking levels of child abuse and neglect. One of the strengths of Communities for Children is the way it promotes community participation to make sure that services are tailored to local needs and respond to the particular kinds of disadvantage that a particular community might face. For example, the Salvation Army's Family Zone Hub at Ingle Farm delivers integrated government and non-government early childhood services under the Communities for Children model. It provides support that parents in the area have identified would be most helpful to them. This includes support groups for women with mental health issues, home visiting, supervised play groups, and parenting support and education, such as budgeting and cooking. The government's also investing more than $19 million over the next 4 years to establish 8 Communities for Children Plus sites.
Could I ask you to formally thank both Carl for his opening introductory remarks and Jenny Macklin for her message. And welcome, my name's Michael White. I'm the Workforce Development Leader at the Australian Centre for Child Protection. And on behalf of the Centre and the University of South Australia, I'd like to welcome you.
Paula has a distinguished international reputation as a keynote presenter and is recognised for her groundbreaking research in the field of early intervention and prevention of anxiety and depression. Professor Barrett is one of the world's leaders in the promotion of resilience in families and communities. Her programs for the prevention and treatment of anxiety and depression have been used around the world in over 17 countries and are recognised by the World Health Organization.
I really dedicated my whole life here to this cause, which is to prevent, directly and indirectly prevent youth suicide in Australia. don't know if you know the statistics, but the greatest cause of death has been consistently in Australia suicide between the ages of 12 and 35, and in particularly affects young males. But it's greater incident than transport accidents, than heart disease, cancer, depression and anxiety, which leads to often to suicide, is a really big health issue, not just mental health issue. And because it's a stigma, we don't really acknowledge it as much as we should, and I don't think we do as much as we need to do about it. So that's really my life mission. I'm very passionate about it.
Hello, I'm Leisha Oliver from Australian Centre for Child Protection, and I've got Lee Peters here from Midland Communities for Children Plus site. How do you think the conference is going so far, Lee?
I think the conference has gone very well, and it's been very informative for me because we're a very new site. In fact, I think we're the baby of sites, and so I've been able to learn a lot from our more experienced C4C plus people. So it's been fantastic for me.
Great, and what's been the highlight of the conference so far for you?
For me, I think Paula Barrett was the highlight. She was very engaging, and she really had the audience captured and in the palm of her hand. And I thought a lot of the information really, for me, was very important in terms of our families and children in the community from which I come.
And what do you think might be some of the key messages that have come out of the keynotes and the breakout sessions so far?
I think some of the key messages are that anything's possible in a community, that where families and children are concerned, they are the community and they are what we help them to be.
What I'm going to do is talk to you a bit about the neurobiological research, but what I'm going to do is not give you the stuff that maybe many of you have heard me talk about before. I want to give you some of the latest stuff. Just last month I was in Cambridge at a neurobiological conference, and the speakers there were telling us the latest stuff that they're doing, and a lot of this isn't yet published, so that's what I thought I'd share with you today. So I'll start the same old way because that's the really important point, and that is that what happens to children in the early years of their life shapes their long-term outcomes. And it's really important that you understand that, because the work that you do in working with families and children who are vulnerable has the potential to change their lives. And as I'll show you later, not just change the lives of the children, but change the lives of the children's children. So I'll give you some of the biology underpinning that at the moment. So irrespective of the fact that you're paid lousy wages and everyone looks down on you, your profession is the most important one in the world, because you can literally change the world with the work that you're doing today.
Today I'm going to talk to you about two bodies in South Australia, and I apologise in advance to those of you who are from interstate. It'll be very South Australian centric, I'm afraid, but hopefully you'll find some interesting things within it. The two bodies are the Child Death and Serious Injury Review Committee and the Council for the Care of Children. And I want to describe to you some of our work in trying to improve the well-being of highly disadvantaged children and their families.
I've got Judy with me from Centre Care in South Australia. And how are you finding the conference so far, Judy?
Good. I'm really enjoying the speakers, the variety and the quality of the speakers. That's been great. And, meeting such a lot of people and re-meeting people. I'll go back to work feeling inspired, I think.
Good. And what do you think some of the key messages have been from the conference so far?
I think the things I've found particularly interesting, I guess, have been about the children's development, the brain, the new research into brain development, all the ways of supporting families and how we do it and how we need to rethink often how well we think about what we're doing and how we approach families on a really conscious level, that we're treating people as equals and conscious of how we can be perceived by our clients.